I want you to stop and read that title one more time. Chocolate, lowering blood sugar, helping treat type 2 diabetes. If your first instinct was disbelief, good, that means everything you have been told about chocolate and diabetes has been doing exactly what it was designed to do. Keep you away from something that, in the right form, your body actually needs. I have sat across from diabetic patients who have given up chocolate completely, who feel guilty at birthday parties, who watches other people eat dessert and silently grieve something they loved. And every single one of them was told the same thing. Chocolate is sugar, sugar raises blood sugar, therefore chocolate is off the table. Full stop. No further conversation. That instruction is incomplete. And incomplete medical advice causes real harm. Here's what the research actually shows. Certain forms of chocolate-specific types, eaten in specific amounts, do not raise blood sugar. They lower it. They improve insulin sensitivity. They reduce the inflammation that drives insulin resistance at a cellular level. They support the cardiovascular system that diabetes silently destroys. The problem was never chocolate. The problem was which chocolate, and nobody ever made that distinction for you. My name is Dr. Miles, 13 years in emergency medicine. I have watched diabetes complications unfold in real time. The kidney failure, the neuropathy, the amputations, the strokes, and I have also watched patients reclaim control of their blood sugar through changes that their previous doctors never discussed with them. This video is one of those conversations. Before we go further, I want to ask you something, and I want you to answer honestly in the comments below. Have you given up chocolate since your diabetes or pre-diabetes diagnosis? How long ago? Tell me below. I read every single comment, and your answer helps me understand exactly what this community needs next. And if you are not subscribed to this channel yet, do that right now. Hit subscribe and turn on notifications. Every week, I release clinical information most people never hear in a routine appointment. Stay with me, because the 5th type of chocolate on this list is the one that surprises every patient I tell it to. Most people have never considered it as a medical food. Ever. Robert was 58 years old and had been living with type 2 diabetes for 4 years when he first came to see me. He was managing his condition reasonably well. Medication, dietary changes, regular monitoring. But his quality of life had collapsed in ways his blood sugar readings did not show. He had given up everything he enjoyed. No alcohol, no bread, no rice, no fruit, no chocolate. He described his diet as punishment food, things he ate not because they brought him any pleasure, but because he was afraid of everything else. He was technically compliant and emotionally depleted. His wife mentioned almost in passing at the end of our appointment that he used to love dark chocolate, that he had not touched it in 4 years, that he kept a bar in the cupboard sometimes just to look at it. I told Robert something that made his wife laugh out loud because she thought I was joking. I told him to eat chocolate. Specifically, I told him which chocolate, how much, and when. I explained the mechanism. I showed him the research. He looked at me the way patients look at you when they think you have lost your mind. He came back 8 weeks later. His fasting glucose had improved. His post-meal readings were more stable. His mood, which is a clinical data point that most doctors overlook entirely, had transformed. He told me it was the first time in 4 years he felt like a human being again, rather than a patient. The chocolate did not do all of that alone, but it was the moment he understood that managing diabetes did not have to mean permanent deprivation. And that shift in understanding changed everything about how he approached the rest of his treatment. Now let us talk about the 5 types. Type number 1 raw, cacao dark chocolate, 80% and above. This is the foundation, the entry point, and the type most people think of when they hear dark chocolate, but most people are not eating it at the right percentage to get the clinical benefit. The active compounds in dark chocolate that lower blood sugar are called flavanols, specifically epicatechin and catechin. These compounds do something remarkable at a cellular level. They activate specific pathways that improve the sensitivity of your muscle cells to insulin. Insulin sensitivity is the core problem in type 2 diabetes. Your cells stop listening to insulin's signal to absorb glucose. Flavanols turn the volume back up on that signal. Your cells become more responsive. Glucose is absorbed more efficiently. Blood sugar drops. But here is the critical detail. The flavanol content of chocolate drops dramatically as the percentage of cocoa decreases and as processing increases. Milk chocolate, which averages 30% cocoa or less, with significant added sugar and dairy, delivers almost none of the clinical benefit. It delivers the sugar spike without the medicine. 80% dark chocolate and above retains enough flavanol content to produce a measurable effect. Research published in the Journal of Nutrition found that consistent consumption of high flavanol dark chocolate improved insulin sensitivity in participants with metabolic syndrome within 15 days. Not months, 15 days. Practical application. 1 to 2 squares of 80% or higher dark chocolate after your largest meal of the day. Not a full bar. Not as a snack on an empty stomach. After a meal, when your digestive system is already buffered, as a consistent daily ritual. Type number 2, raw cacao powder. This is the purest form and the most potent. Raw cacao powder is made from cold-pressed cacao beans that have not been roasted at high temperatures. That distinction matters enormously. High-temperature roasting destroys a significant portion of the flavanol content. Raw cacao powder preserves it almost entirely, delivering a flavanol concentration that is meaningfully higher than even high-percentage dark chocolate bars. Think of raw cacao powder as dark chocolate, with the volume turned all the way up. The same compounds, the same mechanisms, but at a concentration that produces faster and more pronounced effects on blood sugar regulation and insulin sensitivity. A study from Harvard School of Public Health tracked participants who consumed raw cacao powder daily for 12 weeks. Their fasting insulin levels dropped measurably. Their markers of insulin resistance, specifically the HOMA-IR score, improved significantly compared to a control group consuming processed cocoa. Practical application. 1 tablespoon of raw cacao powder stirred into warm water or unsweetened almond milk every morning. No sugar added. A small amount of cinnamon, which itself has documented blood sugar lowering properties, can be added for flavor and additional benefit. This is not hot chocolate. This is a clinical morning ritual that Robert now follows every single day. Type number 3, cacao nibs. Cacao nibs are simply raw cacao beans that have been cracked into small pieces. No processing, no added sugar, no dairy, no sweeteners of any kind. Pure cacao in its most unaltered form. What makes cacao nibs uniquely valuable for diabetics is not just their flavanol content, though that is exceptional, but their fiber content. A single tablespoon of cacao nibs contains approximately 2 grams of dietary fiber. Fiber slows digestion. Fiber slows glucose absorption. Fiber flattens the post-meal blood sugar curve. And unlike processed chocolate products, cacao nibs deliver this fiber alongside the flavanols rather than replacing it with sugar. Feel cacao nibs in your hand. They are crunchy, slightly bitter, intensely chocolatey. That bitterness is the flavanol content you can literally taste. The more bitter, the more medicine. Practical application. A tablespoon of cacao nibs sprinkled over Greek yogurt, added to a smoothie, or eaten directly alongside nuts as a snack. The fat from the nuts slows the already minimal glycemic impact further still. This combination, cacao nibs and mixed nuts, is one of the most blood sugar stable snacks a diabetic can eat while still feeling like they are eating something genuinely satisfying. Type number 4, sugar-free dark chocolate sweetened with stevia. This is the bridge type, the one that makes the transition from regular chocolate to therapeutic chocolate feel sustainable rather than punishing. For patients like Robert, who love the experience of eating chocolate as much as the flavor, the texture, the ritual, the satisfaction of a proper square of chocolate after a meal, raw cacao powder and cacao nibs, while clinically excellent, do not fully replace that experience. Sugar-free dark chocolate sweetened with stevia does. Stevia is a plant-derived sweetener that produces no insulin response and no blood sugar elevation. It delivers sweetness without the glucose. Combined with a high percentage dark chocolate base, it produces a product that retains meaningful flavanol content while delivering the full sensory experience of eating real chocolate. The important distinction is the sweetener used. Stevia is clinically safe for diabetics and well studied. Maltitol, a sugar alcohol used in many commercially labeled sugar-free chocolates, does raise blood sugar and should be avoided. Read the label. Stevia is the word you are looking for. Practical application. 1 to 2 squares of genuine stevia-sweetened dark chocolate as an after-dinner ritual. Eaten slowly, deliberately, as a signal to your brain and your body that managing diabetes does not require the permanent removal of pleasure from your life. Type number 5, ceremonial-grade cacao. This is the one that surprises people, and it deserves its own explanation. Ceremonial-grade cacao is a specific preparation of raw cacao used traditionally in Central and South American cultures for centuries. It is made from whole cacao beans, not defatted powder, not processed chocolate, ground into a thick paste that retains the full fat content of the cacao bean alongside the complete flavanol profile. That fat content pure cacao butter is what makes ceremonial cacao clinically distinct from every other form on this list. Cacao butter is composed primarily of stearic acid and oleic acid. Stearic acid is metabolized differently from other saturated fats. It does not raise LDL cholesterol and has a neutral to beneficial effect on cardiovascular markers. Oleic acid is the same monounsaturated fat found in olive oil, with documented anti-inflammatory and insulin-sensitizing properties. The combination of whole bean flavanols, natural cacao butter fats, and zero added sugar produces a food that simultaneously addresses blood sugar regulation, cardiovascular inflammation, and insulin sensitivity through 3 separate biological pathways at once. No other form of chocolate achieves all 3 simultaneously. Research from the University of Copenhagen found that participants consuming whole cacao preparations closest in composition to ceremonial-grade cacao showed improvements in endothelial function, reduced inflammatory markers, and improved fasting glucose within 4 weeks of consistent daily consumption. Practical application. A small preparation of ceremonial cacao, approximately 20 grams dissolved in hot water, consumed in the morning as a replacement for coffee or alongside breakfast. It is thick, rich, intensely flavored, and completely unsweetened. It is an acquired taste for some. For others, it becomes the ritual they look forward to most in their day. What all 5 have in common: raw cacao dark chocolate, above 80%, raw cacao powder, cacao nibs, stevia-sweetened dark chocolate, ceremonial-grade cacao. The thread connecting all 5 is the same high flavanol content, minimal or zero added sugar, and an active biological mechanism that works with your body's insulin system rather than against it. The chocolate that damages blood sugar is not chocolate. It is sugar with a small amount of cocoa added for flavor. That distinction, which no one ever explained to you, is the difference between a food that harms and a food that heals. Robert still has his bar in the cupboard, but now he eats it. 1 to 2 squares after dinner, every single evening. And his blood sugar is better than it was when he was eating punishment food and feeling like a patient instead of a person. Subscribe to this channel right now if this gives you something real today. Share this with someone who gave up chocolate after a diabetes diagnosis and has been quietly grieving it ever since. The answer is not permanent deprivation. It is knowing which chocolate and why. And tell me in the comments, which of these 5 are you going to try first? And how long have you been avoiding chocolate? I want to know. I read every single one. I am Dr. Miles. Diabetes is a condition to manage, not a sentence to serve. Manage it with the right information and you get your life back. Starting today. I'll see you in the next one.